Hey, welcome into the television version of Strategies for Living. I'm marriage and family therapist David McMillan. Of course, Strategies for Living, what are we all about? We're about helping us live healthier, happier, more peaceful lives in our bodies, in our minds, in our spirits, in our relationships here in the 21st century. And we do that by engaging in conversations with folks we like to call life strategists every time we do Strategies for Living. And if you've watched Strategies for Living for any length of time, many years ago,
been a long time.
Many years ago, this program had a co-host. His name was Dr. Ernie Calgar, and he appeared here. Sometimes he would sneak in at the last minute, but he was here.
I made it.
Dr. Ernie Calgar, who is a counselor educator at Louisiana Tech University, where he is professor of counseling. Welcome, Professor.
Thank you.
Ernie is also a member of our LPC Board of Examiners, and the month of April is Counseling Awareness Month. So I've invited Ernie to come and talk with us today about the profession of counseling. And you know, Ernie, PhD, LCSW, MD, MP, LPC, LMFT,
It sounds like a smorgasbord,
HIJK11OP. When I need to seek professional help, when I've got issues and problems, in that alphabet soup, how do I begin to know what letters to choose? Is there any easy way?
I think it gets very confusing and complex, especially for public.
It does. But with this month of April, and people may be watching this on YouTube outside of the month of April, it's still relevant to talk about counselors and counseling as a profession, because you and I are both proud of the profession that we're in. And, you know, counseling is a profession that from its very inception is about dealing with normal, everyday folks. I don't know if I want to put you and I in that category and scare people off or not, but
sometimes
normal, everyday people with issues. And we all have issues.
My saying is, all God's children's got issues.
Absolutely. And so counseling was actually, from its inception, was about dealing with normal folk, right?
Correct. And helping people get some kind of focus again if they've lost that focus.
Yes.
It's kind of like I need to get back on the road sometime.
Yeah.
Because we can all get off the road in our journey through life.
Absolutely.
So it's like, how do we help ourselves get back on that? And sometimes the best way for me to do that is to go talk with somebody.
Do I know right away if it's appropriate to see a counselor versus a psychologist versus a psychiatrist versus a social worker, let's say? We've got some good licensed clinical social workers. We've got some good psychiatrists, some good psychologists. Is there any easy way to know where I need to start if let's say I'm feeling anxious, or I'm feeling depressed, or I'm having a problem in my relationship, or I'm having a problem with somebody at work? Is there an easy way to tell whether a counselor, I like the idea, I think, of going to a person that can help me with my normal problems. I like that word normal. We all want to be normal, don't we?
Yes.
So is there any downside to starting with a counselor? I guess that's what I'm asking.
No, I think this may make sense, or it may even be confusing for some people. If we think of, I had my eyes checked, see, so do I go to an optometrist or an ophthalmologist? And the difference in that is somewhat like what we have in counseling.
Right.
It's like, because the ophthalmologist is going to be an MD first.
Right.
And so if I think I need some medication, or if my eyes are really bad, or if I think I need surgery, then
I think I have a disease.
I need to go see an ophthalmologist.
Right.
But I could go see an optometrist, and I've done both.
And an optometrist is a PhD level professional, but they don't go to med school.
They don't
go to
med
graduate school.
Correct. And so they've been trained, and then they know when to refer to someone that has more specialty than they do. And
That's a very
and
good
that's-
point. That's a very, very good point. Because if you start with a counselor, and counselor education, counselor training being what it is, part of our professional regulations and rules that we follow is if a person comes to us and we see that it's appropriate for them to be treated at a higher level, a licensed professional counselor is going to make that referral, aren't
Correct.
they?
And it may even be that I go, for instance, I could come to you,
Right,
and you may decide that say I have depression.
right.
You may decide that it might be good if I'm checked for medicine,
That's right.
so to get an antidepressant.
Right.
So then you could refer me to a psychiatrist, or it could be any MD.
Could be back to your family doctor. I
to
may
my-
ask you if you have
my
a
internal
family
specialist. Yeah.
physician or an internal specialist or an
Yeah.
OBGYN,
Correct.
if you're female, and refer you back. However,
And then I would still come to see you
for counseling.
to deal with the issues that I have.
Right. And many times it's appropriate for individuals to see more than one professional like that. For instance, if you're going to a prescriber, an MD, or in our community in Louisiana, we have MPs, medical
Correct.
psychologists. Some psychologists have prescription writing privileges. Again, not unlike the example you gave. Optometrists can write, in a very narrow sense, some prescriptions, as dentists can. And so MDs aren't the only ones that can write prescriptions.
And nurse practitioners.
And nurse practitioners. So if it's appropriate then, you might be referred by your counselor back to your family doctor, or as you're assessed, maybe it's a little more serious than that, so you need to go see an MP, a medical psychologist, or a psychiatrist. But your counselor will dialogue and talk with you about that, and you'll have an understanding of why.
Yes.
Yeah.
And if I were serious enough, say that I really had, was having some difficulty and in danger to myself or to other people, I might be referred or need to go to the hospital.
Yes.
Okay? So if I go to a hospital, then the psychiatrist is going to be over the team.
Right.
That would be treating me.
A medical doctor is the only professional that can admit to a hospital in the state of Louisiana.
Okay, and I think maybe the medical psychologist
They
might
may
be able to
they-
do that sometimes.
They may have, they may be able to do that on occasion.
Okay.
Yeah.
So, and I think there's nothing wrong with seeking help. That's been a real stigma sometime for people.
Why are we so reluctant when it comes to our brain? Why is it, do you think, that we'll go get help for our heart, we'll go get help for our kidneys, we'll go get help for our lungs? Those are vital organs of the body, and we understand that. What is it about the brain, Dr. Ernie, that makes us say, ooh, I want to stay away from there?
Well, see, I think it even ties into our emotions. That when we think we've kind of lost it emotionally,
Right.
I think it can become embarrassing for some people. And even that I have to ask for help in that. And we need to get over that because it's just like if I broke my arm, I don't have any hesitancy in asking
Of
for help.
going to the emergency room and asking the orthopedic doctor that treats me to set my arm and get me back on the road to recovery.
So I can have the support that I need and do what I need to do to.
And sometimes we need that same help. Counselors, as a profession, are going to help us take a look at things like our feelings, our thoughts, our emotions, and our behaviors. And that may be separate from, let's say if I'm depressed and I need an antidepressant, so I go to the doctor and I get that. That antidepressant may help me, in fact, but then I may be able to help myself and help myself help the antidepressant
may
if
be able
I
to speed it
address
up.
my behaviors, thoughts, feelings, and emotions.
Correct.
Okay.
Yes. And I think we've just got that I shouldn't ask for help.
Right.
You know, and this is really big in the military, and we're finding that with people that have been to Iraq and Afghanistan, and then are coming back with all these problems
All
and
the things that
difficulties.
need
which,
to be worked out.
Man, if I went over there, I would be coming back with issues, I think, doing some of the things that they have to do.
Right.
But there's a real reluctance, especially in the military, because of that. I've got to be that strong person, and even I may get punished sometimes. I may feel in my job if I say I need help.
And I think it's an excellent point you're making with the military, but we probably also sometimes get that messages even within our family.
Oh,
Even within our families, the message may be
strong.
real men are strong. Real men don't go to people for help.
Well,
or,
and just like we do with little boys, many times we say, boys don't cry.
Right.
You know, so it's like, you know, I may come up to, you know, well, you need to stop crying, suck it up.
Yeah.
You know, let's go,
Yeah.
come on.
Yeah.
Get back out there. I know we do that a lot in sports.
Right.
So we tend to negate sometimes the feelings that go on in males, and saying that males need the same kind of loving and nurturing and
And you know,
support.
sometimes we do that some females get
Females.
that message too.
Yes,
you
about,
know.
especially if you're firstborn and you're the one to take care of the family.
I was working
kids.
last week with a young lady who actually has ADHD, and she's a nurse. But because she got a message from her family that, well, you know, you don't, if you keep taking this medication, you know, somebody's going to identify you as a drug addict or a drug seeker. Well, so she stopped taking her ADHD medication, and guess what? She's no longer a nurse.
Yeah.
She can't function as a nurse. She still has her license,
yeah.
but she cannot, without the medication, she can't function properly. Can't keep it together to do her charting and all the other things that need to happen as a professional. So we get all kinds of messages.
Yeah. And see, and I think that happens to a lot of people in their work.
Absolutely.
That doesn't have to be something with critical care like the nurses are doing. It can be, you know, that I'm going to my office and all of a sudden I start feeling stressful, or some other things are happening in my life, and I don't understand why it's affecting me at work, or why it's affecting me with my relationship with my spouse if I'm married, or with my kids, or with my parents, or
Right.
friends, or whoever it may be.
And these are all things that counseling can help with. We are talking to Dr. Ernie Calgar today. He's our life strategist, professor of counseling at Louisiana Tech University, and member of the LPC Board of Examiners. We will come back. We'll talk more about counseling because the month of April is Counseling Awareness Month. More with Dr. Ernie Calgar here on Strategies. Stay with us.
Mom was diagnosed with Alzheimer's at 58 years old.
8 years into the disease was when all the light went out.
For me, it was heart-wrenching.
Looking into the eyes of somebody with Alzheimer's, sometimes you just don't see the person's soul is like gone.
And it takes a toll on everyone. I mean, it's a depressing disease to watch unfold before your eyes.
She actually thought those of us who were caring for her and who loved her most were her worst enemies.
More and more responsibilities fell on my shoulders.
This disease just ravages a family.
It changes your life.
The magnitude of it is indescribable. My mother taught me to be in the moment.
We have to live in the moment with them.
And I'm going to be with that person right now in this moment, wherever she is.
Now is the moment. If we work together, we can stop this epidemic.
Contact Bright Focus and learn more.
Hi, I'm Hannah Storm. I was born with a significant facial birthmark. I know what it's like to grow up in a world that looks at you very differently. Fortunately, I had access to care. But every day, many children courageously face the world with physical imperfections and deformities. Some are born with these, others get them from disease or injury. Sadly, many assume they have no choice but to tolerate them. But it doesn't have to be that way. There are medical procedures that can help these children regardless of their ability to pay. Together with the Caring for Kids program from the Plastic Surgery Foundation and the Hannah Storm Foundation, there is hope. With your help, we can give these children a new outlook on life. I know, I was one of them. Help a child in need at thepsf.org/kids.
It's time to join forces. Get energized and fuel up right. Because starting today, every kid in America has a mission. Bring out the action hero in you. Be part of the greatest action movie ever. The first movie that puts you in the action. Show us how you train and eat like an action hero. Join in at actionheroalliance.com.
And welcome back into the television version of Strategies for Living. I'm marriage and family therapist, and I should say today, licensed professional counselor, marriage and family therapist, licensed professional counselor. There's those, that's part of that alphabet soup.
Right.
David McMillan with you here on Strategies. You're watching Strategies today. Don't forget you can listen to Strategies. We started on the radio 20 plus years ago.
A long
Ernie.
time ago.
Strategies for Living is still on the radio. News Radio 710 Keel Sunday mornings between 9:05 and 10. You can also read us in the Shreveport Times every Wednesday in the Voices section. And we're talking about counseling today because the month of April is Counseling Awareness Month. Dr. Ernie Calgar is our life strategist today. He is a counselor educator and has been for 125 years.
That's right.
He's a full professor of counseling at Louisiana Tech University, also a member of our LPC Board of Examiners.
That's right.
Protecting all of us, making sure that counselors do what they're supposed to do.
And I'd like to plug your article that you had in the, it was April 22nd issue.
Yes, last Wednesday.
Last Wednesday that talks about, if someone would like to read about what we're talking about today, you do a really great review.
Thank you. Thank you.
Some of the differences.
You can't. You probably can't find the printed version out there, but you can get it online.
You can get it online.
Go to the Times.
And one thing that I like that you did, you give. We've come up with nationally come up with a definition.
Yes.
That one of the difficulties with counseling, the area of counseling, is that there's so many areas. It's so broad.
Yeah, you've got career counseling, you've got mental health counseling, you've got school counseling, you've got addiction counseling. So there's a lot of flavors, even underneath the broad umbrella of counseling.
Yes. And so it was very difficult to come up with a definition of counseling that everybody in this large group of 40,000 or plus people would agree with. But this is the consensus now. It says it's a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals.
I like that, mental health and wellness. So the emphasis when you go to a counselor, so many of us, I think, are concerned. I'm coming to see my counselor, Dr. Calgar. Am I going to be labeled? Is he going to put a diagnosis on me?
Well, and if insurance is being filed, then that person may have to put a label on you or a diagnosis.
Right.
And I really don't like that. And one of the differences in counseling with the other professions is that traditionally counseling was against labels.
We are issues driven.
We're issues driven.
Not labels driven. So if I come in and I've got a problem in my relationship, you're not immediately going to see me as with a personality disorder, let's
Or
say,
that I'm
or
crazy. You know,
crazy.
is a term
Yeah,
is a
sure.
term that we use normally that
Right.
we don't know what it means exactly.
Right.
But
Right.
everybody is.
But it's a label.
It's a label.
And it's a label that many people throw around and are concerned about. But a professional, particularly a professional counselor who's been well educated, especially if he's come through the program that you're teaching in at Louisiana Tech, counselors are not going to be so quick to put that label on. They may have to for your insurance purposes.
The insurance.
But they're not going to be quick to think of you as, oh, here comes that depressed person.
And what drew me to counseling, per se,
I was gonna
instead
ask
of
you that.
psychology, you know, the psychologist or being a social worker, or was that I came out of more of a developmental model that focused more on health
Right.
and what we can do and the strengths that we have than what I lack.
That is I think that's one of our strengths as a profession, Ernie, that we do focus on, no matter what's going on with us at the time, how do I get better? We're always pointed towards wellness, aren't we?
Yes.
Yeah.
And sometimes with the medical model, it's focused on illness.
It's focused on pathology. And sometimes, I mean, there's a lot
there's
of
a place for
wonderful
pathology.
psychologists and psychiatrists out there, but I don't know about you, I don't want to be seen as a label.
Yeah.
You know. The other thing that I think is important about that definition that the counseling profession has now agreed to is the key word of relationship. Talk to us a little bit about relationship and why that's important.
Well, we as humans are relationship people. I mean, we're oriented toward relationships.
Yes.
And most of us would even feel bad if we weren't able to relate with other folks. It's like there are hermits but it's very difficult to develop and to grow if I don't get feedback from somebody else besides me.
Right.
Because I don't know sometimes I don't really know what I'm doing that might affect other people.
In many ways, the relationship of counseling is almost like holding a mirror up. It's non-judgmental, typically a very non-judgmental holding of that mirror up. But it's a way that I can get a reflection back of what I might be sounding like, what my behavior might be saying to other people. So it's about the importance of forming that relationship.
Yes. And I think it's important that I find someone to talk with that I feel like I can have a good relationship.
Can I interview counselors?
Sure,
I mean, do I need to just go pick one out of the phone book and take my chances, or is it okay to interview?
I think it's great to interview. You know, it's great to talk to other people about what they know about, just like we do that about dentists or about somebody, like I had back surgery, so I started talking to people about
who's good at fixing backs.
Yeah. So, you know, so the same thing goes with therapy. And sometimes it's called therapy and sometimes it's called counseling, and it's all the same thing.
Right.
See, we're helping people deal with issues that they have.
And deal with the normal everyday issues that we all have.
And sometimes those issues may go to the extreme, and they may not be seen as normal by a lot of folks.
Right.
See, but that doesn't mean that I'm terrible.
Right. Right.
So I've got to get away from the fact.
I've got to separate out myself from my behaviors and my issues.
Even my thoughts.
Right.
See?
Right.
And how, you know, that I am basically an okay, good person, see, and a human being.
At my core.
At my core. So how can I get in touch with that again? So, and it's in that spiritual side even, about how can I expand so I kind of get universal in my approach and
if you want to do that, remember these letters: LPC, Licensed Professional Counselor. They are specially trained, highly trained individuals that are trained to help you deal not with all of the pathology, but to help you deal with normal issues of everyday life. Don't forget counselors. The month of April is Counseling Awareness Month, and Dr. Ernie Calgar, I just appreciate you coming to Strategies for Living
Well,
and
and if
being
you're
our life
interested in being
strategist.
trained in this, we do that at Louisiana Tech Barksdale. So it's
Louisiana
done
Tech University right
at-
here on Barksdale Air Force Base.
Right
Okay.
on in Bossier.
All
So
right.
you can get the whole program.
Okay, and
Okay.
so if you want more information, call Dr. Ernie Calgar
Okay.
at Louisiana Tech Barksdale Air Force
Yes,
Base.
456-5005.
456-5005. Always
Okay.
looking for people interested in the counseling profession. Folks, thank you for tuning
Thank
into
you.
Strategies for Living, and we will see you next time right here on Strategies for Living.